emergency department at Ocean Springs Hospital. We're going to talk to Dr. Boscovich in a minute about the common symptoms that we're seeing here with all the patients that are coming through our door during this time. But first, we're going to kick it to Lee for the stats today.
Thanks, Sarah. So we had 58 positives today, better than yesterday, a few less. I wonder or feel if we might be hitting the plateau of the second curve, so I'm an optimist, but it feels like that could be the case. So we need people to continue physically distancing and things like that. The message I sent to everybody on our team today was stay out of your family's face. Again, our contact tracing shows that people get it most from their family and from getting in the face of your family. Don't get in your family's face. But another thing I want to mention related to the stats is that when you see the numbers reported from the state, remember, sometimes those come in a batch, or even here, you might have a weekend batch, a little bit of delay. That's why we use the 7-day average as the best barometer. And our 7-day rolling average is still not good, it's 75. But again, today being a little bit down gives us some hope. Also, we're down, we've got 2 less inpatients, we're down to 30 in total that are either in the ICU or isolated in the isolation units of med-surg. So that went down a little bit. So let's hope people keep up the good work.
But to add to that, we tested almost 500 people last Friday at the fairgrounds in Pascagoula.
Right.
And so far, the results have been trickling in, and 28 so far have been tested positive from that event. So we have large numbers of tests going out each and every day. So the numbers are going to keep increasing, but hopefully, the severity of it won't be as bad. But Dr. Boscovich, thank you so much for joining us. Tell us a little bit about the symptoms that you're seeing.
So typically, COVID is a viral pneumonia, so we typically expect viral type symptoms that you would see with the flu, and we always say there's a little bit of a twist. So runny nose, cough, congestion, sore throat, body aches, tiredness. Then you get into the chest pain, shortness of breath, are a little bit more severe. And then sometimes you even get GI symptoms, a little bit of abdominal cramping, nausea, diarrhea, vomiting. Those typically don't predominate, but they are generally present in some degree. We also see some weird symptoms. This is the twist, the loss of taste and smell, or sometimes even a rash. So it all comes in all different
It could be
flavors.
just one. It's certainly not always all of those symptoms. It could just be one or more of those.
Right. So you could. That's the funny thing. We sometimes see where you could just have one. You could have all 8, 9, 10. It depends on how your body responds to it. You could have no symptoms and potentially have it, which is kind of something we're seeing with this disease also.
So fatigue, for example, if you have extreme fatigue, and I heard you use a medical term earlier today, if someone is at their normal level set and they feel different than they normally feel, not well, that's a symptom. So tell us a little more about that.
The homeostasis is sort of where your body likes to live. So if you are outside of that, if you wake up every day and you are a little congested and you have you feel a little tired because you didn't sleep well last night, that would be normal for you. If you wake up and you're exceptionally drained and you have a sore throat and you have a headache and you're exceptionally congested, that's not your normal homeostasis. You're outside of your normal, where your body likes to be. So that would be, you would be symptomatic at that point, we would say. And potentially, we would check you out and get evaluated.
Very interesting. So I guess one thing too for people, is if somebody just feels like one of those things is off and they're not having, severe respiratory distress or something, probably the ER is not the ideal place for them. They probably should try to contact our 809-5044, talk to their primary care physician. It's probably the best bet generally for that, right?
It is the best. With how we've been seeing this spread in the community, what I've been saying is that if you have been exposed potentially and you start to have symptoms, it's likely or possible that you may have it. In a scenario where you are symptomatic but minimally, if you feel like, well, I'm a little congested, I have a cough, but I can generally tolerate it, call the number, get with your primary care provider, find a way to get a test, and then generally avoid your family members and try to stay inside, wear a mask, obviously, that kind of thing. If you are outside of your comfort zone where you start having chest pain, shortness of breath, you're vomiting uncontrollably, obviously come and see us. I'll always take care of you and do our best to make sure everything's okay.
Indeed, we will. And one thing I saw that in addition to COVID, you guys need to be able to have the time to treat strokes and heart attacks and things that are true traumas and emergencies. So we just got another award.
Yes, we have the American Heart Association, Stroke Association, Get With the Guidelines Gold Award, which means we're the fastest when it comes to getting you the care you need, whether it be the TPA for strokes or the cath for a heart attack. So talk about a little bit of that. Is it safe for these people having symptoms to come into our place?
Absolutely. Don't delay with anything that you potentially perceive as being life-threatening. If you're having terrible chest pain and that's unusual, or if you're having a headache and you can't move your right side, don't sit at home for 3 days. We did see that early on, and it was terrible. And we want to always take care of you. We will protect you. We know the virus is there. We're getting better at treating it and identifying it and isolating people that we know have it. But please don't delay if you feel like you have a medical emergency. Come to see us or get to see somebody.
So I know for a fact these guys will take good care of you no matter what your problem. Got a great ER, great group of doctors, nurses. They're awesome in what they do. So if you have an issue, please come see them. It's safe, and we appreciate what they do for us. So tomorrow we're going to go over to our first Facebook Live from Garden Park, the future Cedar River Gulfport, and we're going to talk to them a little bit about some of the things we're planning there. So you want to tune into that. But it's really nice having multiple hospitals. You work at both the hospitals here in Ocean Springs and Pascagoula. So I think having another hospital in our network with y'all's fast ER ability, it's going to be great. We look forward to that and what it brings. So
In the
anyway.
meantime, stay safe and strong.
That's right. Please do.